Absolutely. There are generally considered to be 3 stages of cancer with regard to how an acupuncturist might support people. At the initial diagnosis, at a middle stage where maybe people are undergoing radiotherapy or chemotherapy, and then later on in those cases where the cancer may have returned. So whatever stage people are at, acupuncture is very helpful at supporting them, supporting their energy, strengthening the immune system, helping to alleviate the adverse effects of conventional treatments. Yes, absolutely. Acupuncture is very helpful at supporting the immune system, at helping people's energy. So the treatments of radiation and chemotherapy are quite strong. Certainly most people, if not all people, will experience some side effects. So for example, with radiotherapy, the common difficulty is that people feel very tired. So treating people with acupuncture can help alleviate those symptoms of tiredness. And similarly with chemotherapy, it is quite a strong treatment, and people do experience side effects of fatigue, tiredness, stomach problems, maybe nausea, vomiting, sometimes loose bowels. I find acupuncture is very helpful in supporting the digestion, helping the energy, supporting the immune system. People who have acupuncture are less likely to have digestive problems, less likely to have tiredness, less likely to have blood problems. Sometimes people develop anemia or low white blood cell counts with chemotherapy. I find acupuncture is very good at helping to prevent those conditions. I think acupuncture's got a lot to offer people for palliative care. It's very helpful at relieving pain, for example, helping again with tiredness and fatigue, just helping people feel better in themselves. It may not fundamentally change the course of the disease, but in terms of comfort and quality of life, definitely acupuncture is very helpful. If acupuncture could be available, for example, in every hospice in the country, people would find they would get a lot of benefit from that. I know there are certain groups that are working in those environments, and patients themselves do talk about the benefits of acupuncture. And I know there are, particularly in the United States, for example, where acupuncture is far more widely used in that situation, that there's a lot of reports showing the benefits from having this treatment. The use of acupuncture in patients with lymphedema, or those who may develop lymphedema because of lymph node surgery as part of their diagnosis or treatment of cancer, is a matter for debate. Certainly oncologists and surgeons recommend that patients with that lymph node surgery shouldn't have any needling on the affected side. There have been extensive trials done of patients in that situation receiving acupuncture treatment. There have never been any problems as a result of using acupuncture, and actually patients report improvements in how their arm feels. Any swelling or edema tends to reduce. I've treated patients for upwards of 20 years with acupuncture for lymphedema. Women, for example, after breast cancer, I've never experienced any problems. So I often recommend that people have treatment to prevent problems developing, or if problems have already developed, then having treatment to actually reduce the symptoms. If people are apprehensive, understandably, about having needles on the affected side, then treating the opposite arm or using other points which will generally help the immune system and fluid accumulation will also be helpful. Whatever medical treatment we are looking for, it's essential that we see a professionally trained person. This is also true, obviously, when we seek acupuncture treatment. So we should always check out from an acupuncturist what their training is, how long their training was, where they trained, when they qualified, and what experience they've had since. Because obviously we want to be in the care of someone who is professional, competent, experienced. Clearly not every practitioner is suitable for every patient, so we need to ask around. Sometimes we might hear by word of mouth from friends or relatives, or we can check with professional organisations. There are registers of acupuncturists where people are bound by codes of ethics, where they're professionally insured. So these are the things we need to find out about so that we feel comfortable that we're having the best possible treatment, particularly when we're having treatment for potentially serious conditions or what you might call more difficult conditions with our health. Then clearly it's even more important that we see someone who's professionally trained.